You're watching the Wellness Hour Live. I'm Randy Alvarez. We're talking about neck lipo today. Who's a candidate? Is it safe? Is it effective? With us, my first guest has strong opinions about this. She is America's favorite dermatologist, board-certified dermatologist, Dr. Tess Mauricio. Dr. Mauricio, welcome back to the program.
Hi, Randy.
Always a pleasure to have you on the show. And for people that don't know you, I've interviewed you, I guess 12 years ago was the first time, and you look, honest to goodness, 10, 15 years younger than your age, at least.
Thank you.
Do you hear that a lot, by the way?
I do. I think a lot of people who see me on TV and they know Dr. Tess Mauricio, and then they see me in person, they almost like look at me like, she looks kind of familiar, but then when they approach me, they're like, oh my God, I never thought you looked this young. Because I've been talking, like you said, I've been on TV now for over 10 years, and then they're thinking I'm a doctor. They're trying to do the math, and they're like, and especially when I'm not wearing my clothes.
You're on the Dr. Oz show, Rachel, just about all the morning shows. Okay, you're all over TV. So when you get people that come from TV, are they surprised and they go, wow, you even look better in person? What do they say?
That's exactly what they say, which I take as a huge compliment, because when they see me in real life, I don't wear as much makeup. They can really come up close. They can see my skin. And they become believers instantly in what we do as far as the non-surgical rejuvenation. And then they suddenly know, I know what I'm talking about, and they trust me.
Okay, good. Yeah, you definitely walk your talk from A to Z. Today, we're talking about neck lipo. Okay.
One of my favorites.
And we should mention, for people that don't know who you are, you have offices all over San Diego.
Yes. In LA, and a lot of my patients do come from all over the world. I have a TV show called the Dr. Tess Show that airs both in the US and Canada, but it's also shown online all over. So we have the pleasure of seeing people from all over the world.
And you have this big celebrity following. I see some of the photos on Facebook, and I'm saying, how come she can't introduce me to any of these people?
We can, yeah. So next time.
But you're of the opinion, and I've had you on the show before we get into neck lipo, that, you've invented this time machine concept. Is that right?
Yes.
It's like a unique protocol?
It's our signature non-surgical combination procedure that is customized for the patient to reverse all of the things that happens with aging, to make our patients look at least 5 to 10, some patients 20 years younger.
Is that right? And
yes.
You're not afraid to say that?
I'm
because
not.
I get doctors on my show and they say, well, I don't want to say that.
No, I'm not, because I can show so many before and after photos of this, the results. I have celebrity unpaid endorsers, just my patients, who love their results, who will go on TV, and I can, walk around town with them and people will stop them and say, my God, I can't believe you're 60 and you look like you're 40, So I'm not, and I see it in my own skin, on my husband's skin, our family members, so it does work.
And your husband looks young too.
Yes, he does.
His skin looks great.
He does.
It's as if both
we
of
just
you...
did it two weeks ago.
Yeah,
both of us have had
this
the time machine.
It was funny
treatment.
because it wasn't a sales job. He doesn't have he's a medical doctor. He
Yes.
doesn't have a sales personality. But in our green room, he says, I had the time machine done. And this is hilarious. See, in my mind, I'm going, this is too much, right? I don't even believe him, by the way.
Right.
But he says, I had it done. I looked at myself in the mirror. I didn't even recognize myself.
He is in heaven. And then like you said, and for guys, because you guys don't have the benefit of walking around with makeup.
Right.
It really is the truth.
I do.
Yeah.
I don't wash my face
because you're
at
a celebrity, but my husband.
The next day I get to wear makeup at the gym.
But my husband, you're seeing his skin, and everyone in the clinic, everyone that he's seen after his time machine procedure have been blown away by his results.
Yeah, because people don't want to look like Bruce Jenner, right?
No, and it's a
Which
shame
is very
because
odd.
And it's a shame because Bruce was a really handsome guy, and that's one of the things. One of the biggest message is that many really naturally good-looking people are being transformed into freaks because they're doing the wrong things, they're getting the wrong procedures done. It is possible to turn back the clock, look younger, but still look natural, and that is my whole message.
You don't have to look different.
You don't have to look different. You can be the best version of you.
Okay, good. Okay, neck lipo.
I love it.
You do?
I love it. It's one of my most favorite procedures to do. Any patient who comes in to see me and I feel that they can benefit from it, I talk about it. It's one
But how does it make you look younger?
It makes you look younger is because when you look at what we perceive as a youthful face, there is really a nice boundary between the jawline and then the neck.
Okay.
And also as we age, our faces tend to get fuller in the bottom, and we start getting the jowls. And you lose that contour, and people come to see me and say, I hate my profile in photos. I caught myself in a video and I saw myself, I'm like, I couldn't recognize.
Because most people see you from the side. I guess when you're looking in the mirror, you don't see the double chin.
Exactly. Or actually, I had a patient, she's a pianist, and she saw a video of herself, with the neck down, and she was horrified. And the neck lipo is such a transformational procedure that it's so easy. It takes about 45 minutes under local anesthesia, no scars left. And I do this procedure, and the day after, when we take off, the patient's compression, they are blown away. They get their jawline back, they get their neck back, they look like they lost about 10 pounds, and they definitely look about 10 years younger just with that one procedure.
So it gives them, so is it more men or more women?
Men, this actually is a procedure, out of all the other procedures that we do, that is almost 50-50 men and women. Because men, they suffer, it's probably a, genetic predisposition that they get heavier here, and it makes them look a lot older.
Okay. Now, with being a dermatologist, I guess tumescent liposuction was the first one to do it in the U.S. here. We're dermatologists.
Yes. A lot of people don't know that.
I didn't know that, by the way.
Exactly. A lot of people don't know that, and plastic surgeons will admit it, but it is the truth. The concept of tumescent liposuction, where we are using very, very dilute concentration of numbing, which, if you go to your dentist, they inject the numbing, the area is numb. But instead of using a full concentration, we're able to dilute that in large amounts of saline, which is what you would get if you go in a hospital for IV. And we use that tumescent anesthesia solution to numb the area so that
How long does it take you to do? For an easy case.
Oh, for the neck, like I said, from start to finish, it's 45 minutes.
And what's the downtime?
The downtime,
ideally,
we usually do our procedures on a Wednesday or Thursday, tell patients take off on that day. You can go back to work on Monday.
Okay.
That's
but you have to wear a wrap, don't you?
That's it. That's so I would tell them, you have to wear your wrap from the time we finish the procedure.
For how long?
24 hours until you go back to work on Monday. And then on Monday, you can go to work. You may have a little bit of
and all your
bruising,
coworkers say, "What happened to your neck?"
Exactly. You'll look. A lot of times, it's
no
so.
more double chin.
The thing is, it's so natural. The results. Most people can't even figure out why you look better, why you look younger. They just think you lost weight.
You started to tell me this one time, and I didn't get it. You said that if you get them young, that it'll hold their neck in place as they age.
It's so much better. What happens is all of us have a genetic predisposition of developing or accumulating fat in certain areas. So some people who, if you look at your family members, they all have, the turkey neck, they all have double chins. This starts happening sometimes late 30s, early 40s. Now, you can wait until you're older to address it. It's going to get larger, it's going to get bigger, worse. But if you address it early, maybe in your late 30s, early 40s, we can remove the fat, the skin, your skin is still able to recoil, and tighten again. It looks like nothing happened.
Because there are thin people, by the way, with double chins.
Right, and so it's not a matter of being overweight everywhere. Some people, they are overweight everywhere and they have that, and we still do lipo, but there are people who are thin, they just have that and they hate it. This is a perfect procedure, but the younger you are, the better your skin is in recoiling. And
recoiling mean what?
Tightening back. So there's no loose skin, because it's always a question they ask me, like, doctor, you're removing the volume in my neck, am I gonna have loose skin afterwards? Now, if we're working on a really old, a lot older patient, then maybe there is, but I tell them it's not gonna be any more loose skin than what you would normally get if you just lost the weight yourself. It actually will be less. And then we can do a lot of other non-surgical skin tightening procedures to improve whatever extra skin you have. If you do it, I would say 40s, 50s, you don't even see loose skin.
And,
it's amazing.
And you do lipo in other areas, right?
Yes.
The arms.
I love it. We do it in the arms, the abdomen, the love handles, the thighs. So these are, common areas where if you have pockets of fat you just cannot lose with diet and exercise, or you want to jumpstart your weight loss program, you just want to look good and then maintain it, this is a wonderful procedure.
So if somebody goes in and you're evaluating their face. Like, what goes through your mind? Okay, so let's say a woman's 40 years old.
Yes.
They go in a meeting with you. What do you want to know? What's going on in your head?
Well, first thing, I ask them what bothers them. Obviously, there's
what do they say?
My evaluation.
Like
Usually in their 40s, they start talking about wrinkles that they don't like. They start looking at the under eye area. They're looking more tired. They're putting makeup on, it's just not going on right. They may not be, they can't find the right makeup. They just look haggard. So those are the common things that people say to me. And then obviously they don't like the sun damage on the skin. They're having to wear more makeup. And so we can address all of those. And then I can make suggestions, like I said, if it's a patient that I think has a fuller neck, and then if I palpate, I feel there's actually fat and it's not just a skin issue, then we can talk about neck lipo.
So you love the neck lipo?
I love it.
Is that? It can make you look a lot younger, you say?
It can make you look a lot younger.
It can
make you look thinner. It can make you look, more chiseled. You have your jawline, your neck. You look better in pictures and videos. A lot of my celebrity patients, I do the neck lipo for every single one of them, because after a certain age, you do lose that definition. And it's so important with a camera and photos and videos.
And it's not obvious?
It's not obvious. Like I'm telling you, most of the people, unless they really know you, they're staring at you, or you show your before photos, they just think that you've lost weight. They're like, God, you look great. They don't even know.
It doesn't really hurt?
People are really surprised at how simple and easy it is. And most of my patients really just take extra strength Tylenol for post-op, they're just uncomfortable. The worst part of the procedure for most of my patients is the compression garter.
You got to wear that.
Yes, they hate that, but the actual pain from the procedure for the neck lipo is very minimal.
You think, especially for the neck, this is your place as a dermatologist to do it?
Oh, like you said.
Is there an advantage that you're a dermatologist?
Well, we discussed earlier that tumescent anesthesia, that whole entire field, that was opened and developed by dermatologists. The subcutaneous tissue.
Like the first guy that did tumescent liposuction, dermatologist.
Exactly.
Okay.
And the subcutaneous fat is actually part of the skin. And so when we do our residency in dermatology, when we do extensive surgery on the skin to remove skin cancer, to remove moles, to remove birthmarks, all of those, our training is really doing surgery on the skin. And that is our plane. So in essence, the muscles and all the things underneath, maybe plastic surgeons, have to deal with that. But when it comes to fat, that's
But there's art to it, right? Some people get better results than others.
It's 100% art. Lipo is 100% art. You can use whatever tool. There's so many lasers and, all the different technologies now to try to help doctors melt fat and sculpt fat. But basically, when you're talking about surgical liposuction technique, it's 100% art.
I've met hundreds of plastic surgeons, and I respect them. I've never met one that likes to do lipo. Not one.
It's a lot of work. It's a lot of work, a lot of dedication.
And I think if you're going to go to somebody that loves doing lipo.
Exactly.
Because I've met a lot of people that love lipo. It's rare, they say, because it's a lot of work.
It is a lot of work.
So I think when you choose somebody that does it, you should ask, how often do you do it? Is it something you like to do?
And as far as it being a lot of work, my patients, because when I do lipo of the abdomen, the arms, my patients are awake. So they see me and they're interacting with me, and they actually are the ones that say, wow, Dr. Tess.
They're getting lipo and they're saying, boy, you look so young.
Yeah, they do, but most importantly, they say they get an appreciation of how much work and dedication it really takes for a doctor to do this right. And they appreciate it now. So that's why, in a way, it's better that they do it awake, because then they know this is not as simple as, oh, you just come in, you get it done. The doctor has to be dedicated to creating the very best
How old
results.
can you be to get neck lipo?
Well, as long as you have that fat that you don't like, I think you're ready for it. And usually that happens, with the natural aging process, late 30s, 40s, although, one of my staff members, she's only in her late 20s, and she has that genetic.
Are you going to do it?
I already did it. She loves it. She's telling all of our patients, and so that's why
I have a friend that watches my show, and his nickname is Double Chin Smitty. And Yeah, in fact, now they've shortened it. They just call him Double, right? And he's a skinny guy, and he's got this thing right here.
Yeah.
He needs to go in.
He needs to go in. There's no reason to live with that. Because it bothers people. It will make him look younger, thinner. He'll have so much more confidence. He'll be taking pictures left and right.
What about women? Women like guys with good necks.
Because women like good-looking guys, you know. I mean, the key is, you know, if it's bothering you, there are people with double chins and heavy necks. It doesn't bother them.
My friend Double Chin Smitty says, Randy, there's no single girls in San Diego that
likes it.
And I'm thinking, it's that double chin of yours. Get rid of the double chin.
We can do an experiment, but I don't guarantee finding a mate after any of our procedures. But if there's something, you know,
what bothers him? I mean, look, it's
you.
Not for everybody.
If it bothers you, if you hate it, it's really interrupting and stopping you from living your life to the fullest, enjoying your life, presenting your very best self to the world. It's a simple 45-minute procedure under local anesthesia, and there are no scars.
Tell me this. You see these low downtime facelift commercials all over the place, and people always ask me about it. Do you think there are people that are getting a neck lift that really all they need is a little bit of lipo?
Yes. It's the same thing with tummy tucks. But for the neck, you know, it really depends on what you're used to seeing, what you're used to doing. Because I don't do the neck lifts, all I do is the neck lipo. I have seen, you know, obviously my patients, even the older patients, where I would counsel them ahead of time, and I'll say, you know, we'll do the lipo, but if you end up with any kind of significant loose skin that you don't like, you can always have your neck lift. We haven't had a single patient who actually have gone in for a neck lift after they've had neck lipo. Do you ever have to turn
people away for
a
lipo of the neck?
You know, if there's any health issues, there's some patients who are on Coumadin or something like that, and they cannot get off their Coumadin, which is a blood thinner. If there are any health issues like that, those are the only reasons.
And where's neck lipo the most popular? In your LA offices? Here in San Diego?
Well, the LA office is pretty busy. We also have a lot of people flying in all over because this can be done in a single visit. And so they'll fly into, you know, our office here in San Diego, where we do it in a procedure center. They have the procedure, they spend the night, we do our post-op, and they can enjoy San Diego or decide if they want to leave that day, they can the following day.
And they get the time machine.
And we've had that too, where patients will fly in, have the time machine done.
Do you have your best result ever? What you know, like your best result where somebody looked 20 years younger?
Yes.
Or the spouse said, you know.
Oh, we have our Jennifer, who was our time machine patient, and she looks at least 20 years younger, at least, and it's changed her life.
Okay,
you know,
good.
She's just so much more confident. Her husband's so happy because it was her husband that actually encouraged her to do it, because she didn't feel like, you know, she wanted to. She felt guilty about doing it.
Psychologically, and I was talking to a plastic surgeon about this the other day in Santa Barbara, and he was saying, you know, Randy, it's amazing the life changes. He goes, some people get out of a toxic relationship. It gives them the self-confidence to dump their, you know, whoever they're with, their partner. Do you see a lot of that? And he says, or it'll create a new marriage, a new romance.
Oh, I have the privilege, I see patients in all situations of life. You know, when people just got divorced, and, you know, we do the transformation and they get this new confidence and they get engaged, they get married, or, you know, so it's kind of like a happy beginning. We have people who just are down because they've been sick or have been taking care of sick relatives, and we do the transformation, and it really lifts their spirit. And that's the best part of my job. Okay, I'm doing the physical transformation, but it creates such amazing internal changes. They're more confident. My patients will say, because I look younger, I feel younger, I'm dressing younger, people are responding to me in a different way. That's
interesting.
And I feel that too in my own personal life, is that, you know, I'm so much happier when I look at myself in the mirror, and you know, it's like, and some people say, even if they don't feel old, when they look in the mirror and they do look old, they feel older.
See, and self-confidence,
it's everything.
Is sexy. I mean, when you see a woman and they're self-confident, it's not so much about the looks, but they're able to smile and talk, and they carry themselves with self-confidence. That's a big deal.
It's a big deal, and
if you could give people some of that back,
and we can, we see it every time. This is the reason why I went into dermatology in the first place, is that I know for sure that even changing and treating people's acne, you know, getting and improving their skin condition can turn people's lives around.
I'm going to mention this because you said this on your show. You have another reason why you got into dermatology, so you can afford nice shoes. You said that on one of your shows.
Yes, I do. I do still work for shoes. I still do. And you know,
how often do you buy a pair of shoes? Once a week?
It depends.
Just tell me.
It depends.
I mean, sometimes maybe.
Sometimes once a week. Sometimes a bulk. You know, at a time.
What's the most shoes you've ever purchased at one time?
In one time, I would say maybe 6 pairs.
6 pairs. Mm-hmm. And you know, especially now that you're going to LA, right? So you 6 pair of shoes, and then you met Imelda Marcos.
Yes.
She was on your show.
Mm-hmm.
After you met her, I'm sure it came up how many shoes she had. Did you come back and buy more shoes by any chance?
I've had a lot of shoes before that. I think it's in my genes, but I just love shoes, and I look at shoes as art. I think it's just part of me being an artistic person, and so it's one of those that it just, especially now, if you go in, I mean, the shoes. Women's shoes now are so fantastic, and being only 5'1", you know, the 6-inch platforms that you can actually walk around wearing, it's a feat of engineering, and it's artistic.
This is an interesting point. You know, we're talking about liposuction, neck lipo, and we moved on to shoes, but it's like you put on a pair of shoes. It's like with me, if I get a new suit, if I'm the right tie, I feel like $1 million.
Right.
You feel good.
That's it. And so people know the concept that, you know, if you look good, you feel good. And it's what your makeup, why do we even comb our hair, why do we even style our hair, you know, why do we even do our kind of essential grooming, is because it's so essential to our well-being, overall well-being.
What if somebody's watching this and they say, she's just totally superficial?
Well, you haven't seen my high school photos. I'm just kidding. No, it's true.
I saw your photos.
It's true.
You had a photo of a marriage photo. Mm-hmm. You look totally different.
And it's,
were you like an ugly duckling or something?
I think I was.
On Facebook, you posted a military photo.
I think I was an ugly duckling, and it's one of those things that I think people can say I'm superficial, but I would say that, you know, what I find in my own life is that I feel liberated. There are so many things about our physical bodies that sometimes holds us back and we don't allow our natural talent, our natural inner beauty to shine through, because that's a block. So if you have those, why are you letting that block, the physical things, block you from living your best lives? That's just how I feel about it.
Do you feel prettier now than you did 10 years ago?
No question about it.
Like your confidence now is so much more?
No question about it. And, you know, having to face like an international public, being on, you know, these national TV shows, it's important that you're confident. And so part of it is how you look. It is a big part of it. And so if, you know, if I can inspire women out there who do have, all of us have these physical blocks, you know, you can remove those blocks, liberate yourself.
Look the best you can.
Live your
with
life.
What you've been given.
Yeah, exactly.
I mean, you know, Barbara Walters, by the way, I met her, and she's impeccably dressed. In her book Audition, she talked about how she was known as unattractive. Mm-hmm. It's one of the reasons why she gives credit for making it in the world.
Right. Because
the executives, the wives didn't mind her being around them.
Right.
But she said she always wanted to look her best. And that was beauty. You know, and so I think with anybody, you might as well look your best. It's good for the job market.
Right.
It's good for your self-esteem. It's good for your spouse, your partner, whatever.
You know, I did a women's seminar, and one of the psychotherapists that did marriage counseling, she said that the #1 reason for marital problems is self-image issues, both mostly from the woman's perspective. When they don't feel attractive, it affects the marriage. And so it is so, and these are things like, you know, get lipo, you can turn back the clock. It's really, you don't even know. A lot of my patients tell me, I don't even know what I've lost as far as my self-esteem, my confidence, the happiness, the joy inside me, until I've given it back with the treatments. And so, you know, you may not even realize it, but that is from a psychotherapist. She said the #1 reason is self-image issues, and it's all the physical things.
Okay, good. And do you ever get on a consult and you're so excited because whatever in your mind you go, this is going to be such a good result, where you have to kind of contain yourself so you don't seem like you're selling something? Does that ever happen?
I'm excited on most of my consults because I think, you know, when they come to me, they really want to see results, and I know we can deliver it. I always under-promise, you know, and it sounds like, oh, I'm over-promising when I'm talking to you, but I always do. I always tell them if I really feel that they need to think about surgical options and what the non-surgical options cannot achieve. I talk to them about that. Good. But most of my patients really, nowadays, I think most people are looking for non-surgical options.
Do you think people underestimate how good they can look?
Yes.
With some of this really?
Yes.
Like,
and
I mean, do you have patients that on a consult?
I've underestimated how good, you know, we can look, my husband and I, and even my patients. Like, some of these before and afters, I'm like, we're blown away. Like, we're looking at it, we can't believe it. And the patients will come in and we're like, oh my God, we're all hugging each other. We can't believe how good you look. And then, you know, how they feel, that's even more. That's even more.
Good, good for you. Well, always a pleasure to have you on the show.
Thank you.
Interesting topic, and thanks again. We like the way you dress, and you're recognized now just about every day. Does somebody say, "Are you Dr.?"
Well, yeah, I was in the casino, and someone chased me inside the bathroom to snap a photo with me inside the bathroom. So that's kind of a surreal experience, but
good.
It's fun, and you know, just hoping to inspire people. Live your best life.
All right, good. Thanks again. You're watching the Wellness Hour. We'll be right back. I'm Randy Alvarez.